siwezi kubali kwamba Public Service Commission inaweza kurudisha watu kazi ambao walikuwa wamefutwa kwa katika circumstances ambazo zilikuwa hazieleweki. Halafu public service ambao ndio inawajiri watu katika serikali kuu inaandika barua inasema watu warudishwe kazi. Lakini kuna yule ambaye anafaa kuwa anakubalisha hiyo maneno happen, sababu kila mahali kuna ile amri zake. Lakini wa kuamrisha anasema sitawarudisha. Yeye ndio mkubwa kuliko national government. Hiyo mmeambiwa kwamba kuna yule mtu ambaye unaona tanki ya oxygen iko hapa, lakini anafinya hewa yako, anataka kukuua. Na si mnamjua? Ambaye anafanyanga tabia za aina hiyo.
That's what the ruling says, that they have been reinstated and they can go back to work. So we are encouraging the doctors to go back to work. No, so far we have not had any communication from the county, but the Public Service Commission is very clear on the declaration, and the County Public Service Board is bound by it. So we don't expect any hesitancy from their side. Right. For sure, don't want to fight the government. And what we have seen with the pandemic is that when we work together, it works better. Because as we have seen, there is a lot of disorganization around COVID because we are not able to talk to the proper stakeholders in the health. We do not want to go on strike as healthcare workers. We would rather sit down and dialogue with the government and come up with systems that work. Because even as we went on strike, we did not go on strike for selfish reasons. We went on strike because we needed the hospital equipped. We needed the hospital clean. We needed infrastructure in the hospital. And even as we speak now, unfortunately because of what happened to us, still the hospital is ill-equipped. Patients are having to buy syringes. The ones who are going to Kirinyaga hospital, they are still having to buy gloves. For the past 8 months, we have not had clean gloves in the hospital. Doing ward procedures without gloves in COVID era is detrimental to the health of healthcare workers. As we speak, the ICU in Kirinyaga is not well equipped. They have built a very good hospital complex, and I commend them for it because we need progressive healthcare in our country. However, how progressive will you be if you have fired all the experienced healthcare workers? You need these healthcare workers so that even the new hospital that has been put up can function, and even the one that is already existing can be strengthened. We are trying to take all the precautions we can, but unfortunately the isolation unit is full, which means that when we get a COVID patient, suspect COVID, we have to put them in the general population. This is made worse when their oxygen saturation is low and we have to supplement oxygen. We don't have piped oxygen, so we have to use concentrators. Concentrators are the plastic boxes you see in the ward where the machine concentrates oxygen from the environment and then delivers it to the patient, which is also hazardous because it aerosolizes the virus, meaning that anyone that is in that space can inhale whatever virus that patient has. I can see you're very worried. It is worrying. We need piped oxygen, and that is not just the situation in Ngirici, it's the situation everywhere. We are lacking in oxygen. We do not have gloves. We do not have enough drugs or lab investigations. It's very sad that in a pandemic, health is becoming worse than it was previously, because last year we had gloves. Now we don't even have gloves. We don't even have basic drugs. For example, in maternity, there is a certain drug that is given to a mother to prevent postpartum hemorrhage after giving birth. We don't have that drug. If the patient cannot afford, then it's really up to their luck. So we are really doing badly in the healthcare, and even as we speak, there is a lot of unemployment of healthcare workers. And we have healthcare workers that are waiting, and they have been trained and they have not been employed, yet patients have to wait too long just to be seen by a doctor. So I want to encourage the county government and at the national government, let's hire more healthcare workers. The only way to protect ourselves from COVID is to make sure that our frontliners, that our healthcare workers are enough in our hospital, they are equipped. We need oxygen, we need ICU, we need these specialists in our hospitals, because as we speak, the situation is not good.
Right. Tunataka kushukuru tume ya kuajiri watu hapa Kirinyaga, na tunafurahi sana hivyo wameweza kuregesha wahudumu wa afya ambao walikuwa wametimuliwa hapa kazini, na tungeomba serikali ya kaunti hivyo imeona ni mzuri warudishe kazini, ijue venye itawalipa marupurupu yao na mishahara ambayo hawajakuwa wakipokea kwa muda mrefu sasa. Na hiyo itahakikisha kwamba ile huduma watu wetu wanapata kwa hii hospitali zetu ni huduma ambayo ni ya hali ya juu.